I'm Judge Penny Wolfgang, and welcome to The Big Picture. National health experts are sounding the alarm, reporting there is a COVID-19 pandemic among the unvaccinated. As a result, are we headed for more mask mandates here in Western New York? Will the positivity rate for the virus continue to rise? And why are some people so reluctant to get the vaccine? Joining us to talk about this is Dr. Thomas Russo, Chief of the Division of Infectious Diseases in the Department of Medicine at the Jacobs School of Medicine and Biomedical Sciences at the University at Buffalo. You may remember that when the coronavirus first made headlines, I connected with Dr. Russo at the Jacobs School in downtown Buffalo for what we believe was the first prime-time interview as the pandemic drew near. Welcome back to our program, Dr. Russo. Did you think we'd be here more than a year later still talking about the coronavirus?
Unfortunately, I did. We anticipated that this pandemic obviously was going to last for a while until everyone achieved immunity. And in fact, I think we've shortened the duration of this pandemic by being so successful in developing vaccines rapidly that are highly safe and efficacious.
I know we talked about it all that time ago. Like we said, it seems like forever ago. And then now things have turned and we did get the vaccine, but are we experiencing a pandemic now of the unvaccinated people?
Yes, really what's going on right now, unfortunately, is a pandemic in the unvaccinated. The vaccinated, and it's important to emphasize the fully vaccinated that have received both shots of the RNA vaccines, are largely protected against this highly infectious Delta variant. But we still have a significant proportion of our population that's yet to be vaccinated. Overall in the country, 50% of us. And even here in Erie County, 43% of individuals are yet to be fully vaccinated. And they're susceptible to getting infected from this highly infectious variant with unpredictable outcomes, unfortunately.
Now, they keep saying this variant is more contagious than the original. What does that mean, more contagious? Do you get it more easily, or is it more serious or more deadly? What does that mean?
When we say something's more contagious, it spreads more readily. So if we take the earliest version of the virus, we thought that if someone was infectious and they were in a room full of people that were susceptible, maybe 1.5 to 2 people would get infected. But with the Delta variant now, that number would be 6 to 8. So it spreads much more rapidly. And this largely explains the rapid increases we've seen in parts of the country, particularly those parts where vaccination rates are much lower than here in Erie County in Western New York.
So is it more serious, the effects of it, as serious as the original, or the same, or what?
So I think we're still sorting out whether the Delta variant is what we call more virulent, or everything being equal, if you're infected with this variant, outcomes are worse. However, I think that even if it proves not to be more virulent, because individuals that are infectious shed so much more virus, anyone that gets 10, 100, or 1,000-fold more virus when they get infected can more easily overwhelm our immune system. And so I think that's why we're seeing more people landing in hospitals, particularly younger people, which we didn't see earlier in the pandemic.
And the big question, among other questions, is if you have been vaccinated, can you still contact the original coronavirus or the Delta or the more serious one?
So as great as our vaccines are, they're not absolutely perfect. Based on a number of studies taken together, the present vaccines, and let's focus on the Pfizer and Moderna vaccines, because those are our best vaccines, afford 88% efficacy from developing symptomatic infection. Against the original versions, that efficacy rate was around 94, 95%. So not quite as protective against the Delta variant as earlier versions of the virus, but really still pretty good. But I think what's most important, although we'll see some breakthrough mild infections, is that vaccination largely keeps people out of hospital and is highly protective from bad outcomes. And at the end of the day, if our vaccines can prevent severe disease and save lives and minimize hospitalizations, I really think that's what we're looking for.
Now, what about the masks? Do we still need them? Should we wear them? Who should wear them? Do they make any difference with the Delta variant or with vaccinated people?
Well, there's a huge body of data that masks protect us against getting infected with all versions of this coronavirus, including the Delta variant, and in fact, really all respiratory viruses. And so really that data is unequivocal. I think, really has been a much discussed topic over the last week is who should be wearing masks and in what setting. And as you know, in areas of substantial or high transmission, the CDC is recommended that we go back to wearing masks in high-risk indoor settings. Now, let me break this down in terms of why I think that could be potentially an important recommendation for certain individuals. Prior to the Delta variant rearing its ugly head, we were using the honor system. Fully vaccinated people were not recommended to wear masks in high-risk settings, such as the indoors or high-risk outdoor settings. But unvaccinated individuals were, because they're still susceptible for acquiring the virus. But unfortunately, I think we learned that the honor system was imperfect. When that recommendation was made, everyone felt the pandemic was over. Everyone was taking off their masks. And then when the Delta variant became more prevalent, all of those unvaccinated individuals were getting infected. So to be clear, the overwhelming majority of infections are in the unvaccinated. 97% of hospitalizations and 99% of deaths are in the unvaccinated. This is really an outbreak of the unvaccinated. However, with the Delta variant, there is also some data, and this is an evolving body of data, that fully vaccinated individuals could get infected and potentially spread the virus, though we think they probably won't do so as efficiently. So as a second benefit from using masks indoors, and certainly less important to make sure that our unvaccinated are wearing masks, if you're fully vaccinated and wear a mask, that will help a little bit, but quantitatively less so. And I think the last category to discuss about masks is we've learned that in certain groups of fully vaccinated individuals, such as the immunocompromised, transplant patients, certain hematologic malignancy patients, those with cancer, and perhaps our most elderly, greater than 80 years old with underlying diseases, vaccination is imperfect. The response is not as great as we'd like. And we've been recommending all along those individuals wear masks to protect themselves in high-risk settings. But if the message did not get through to those individuals, that would be another benefit of the mask mandate.
I can't understand, and I don't think you can or anybody can, but I'm going to ask you anyway, why people would not want to get the vaccine. What are the arguments? What science or what reason do people have? Is there anyone who should not get it? Should pregnant women get it, for example?
Yeah, from a public health, medical, and scientific point of view, there's almost no one that should not be vaccinated. Both their own personal health benefit, for the benefit of those loved ones that they surround themselves with, because they could potentially spread the virus to them, and our community overall. So imagine if everyone was vaccinated right now, we wouldn't be having this discussion, right? This pandemic would be in the rearview mirror. But unfortunately, there's still a significant minority of individuals that are not fully vaccinated. Half of the people in this country. And there's a large number of reasons why this is the case. Much of it is due to misinformation. People still believe this pandemic is much to do about nothing. Hard to believe that, but people still tell me that. And of course, there's a variety of other reasons as well. Inappropriate fears about the safety of the vaccine due to misinformation that's been disseminated on social media and other sites. And so I fully agree with you. Everyone should really get vaccinated with some very rare exceptions. And unfortunately, we have really not done a good job with that, despite widespread availability of the best vaccines in the world here in the United States.
It was so hard to get at the beginning, and that was the whole conversation. How could we get it? Who can get it? And now it's so available, and we're having this conversation about whether people should get it or not. It's really difficult to understand. Do you think there's conversation about the booster? Do you think that people who are vaccinated, any particular problems that they have, that they're going to need a booster, or will we need one just automatically, like every year we need a flu shot?
We're still learning about if and when we're going to need a booster shot for the majority of individuals. I think the data presently supports that for most people, we'll get at least a year out of this vaccine, but this is something that's being monitored very closely. However, one group that we already discussed should be wearing masks that might have not had an optimal response to vaccination, the immunocompromised and our most elderly, particularly with underlying disease. There's an increasing body of data that they would benefit from a booster. Several countries have already initiated that. Israel and Germany have done so. This is being discussed here in the United States, and I suspect that there will be a recommendation for that group of individuals to receive a booster sometime in the near future. Still waiting to hear on that, though.
Well, to be decided, to be determined, I guess. If the FDA, I just learned from John actually, that the FDA has not officially approved the vaccines. Is that true? And if so, if they approved the vaccines officially, would that make a difference in people's minds, do you think?
Yes, I think it would. So presently, the vaccines are approved under emergency use authorization. People have gotten confused by that designation, and somehow some people think this is an experimental vaccine. That is far from the case. We have great safety data. And really the main difference between emergency use authorization and full licensure is 2 versus 6 months of safety data, which we now have. That data has been submitted to the FDA. They're reviewing it. The word is that the data looks great and there's no new safety signals of concern. And we're all anxiously awaiting full approval, because I think that'll, move a few people from being on the fence and get vaccinated, which is obviously what we're hoping for at this point.
Do you foresee that we're going to have a time when the same drastic measures that we went through last year, working from home, wearing masks, distancing, all the things, businesses, closing, do you see that happening?
No, I don't. I certainly don't see lockdowns. I think we're past that. And fortunately, certainly here in Erie County in Western New York, I think the risk of overwhelming our healthcare system is behind us as well. We've done pretty well vaccinating our most vulnerable. We've been imperfect. There's still 22% of people over 75 years of age that are yet to be fully vaccinated here in Erie County, and that's a disappointingly high number. But having said that, the vaccines work. We're getting more people vaccinated. We're having a bit of a surge here due to the Delta virus. It's so infectious. This surge will pass, hopefully, as we get more people vaccinated and people protecting themselves that are susceptible with masks while they're awaiting vaccination. I like to call that a bridge to vaccination. And I think that we might have a little bit of a transient quiet time sometime around September, early October. And then I think the final sort of, blip or surge of this virus, the magnitude will be dictated as how well we do with vaccination is going to occur in that Halloween, Thanksgiving, religious holidays, New Year's combination, right, with the cooler weather here when we move indoors. So I'm hoping that'll sort of be the last stand for the virus. And as we head into 2022, we'll be mostly in the clear, because people will either be vaccinated or unfortunately infected at that point.
I like a lot of what you said and a lot of your answer, except where it came all the way to like Halloween and holidays and New Year's. It seems like that's so far away and it's been so long. I don't like that part of the answer. but otherwise
I
it was.
know, either do I. I mean,
I like
we're
that
all
part.
hoping that we'd have a great summer, we'd be done with this virus. But I think here's the reality we're facing. You know, that earlier talk of herd immunity, if we hit some magical number, 70, 75%, the virus was going to disappear off the face of this earth. That's just not going to happen. There's going to be two classes of people at the end of this pandemic. Those that were vaccinated and are protected, and those, unfortunately, that got infected, which many of those individuals will have a bad outcome, as we know, or potentially intermediate or long-lasting consequences of getting COVID. And at this rate, given how infectious the Delta variant is and how we're doing with vaccination, I'm sort of anticipating that we still have a number of months to get to that point. No one's going to be able to dodge this virus. It's going to find you. And so your best strategy to protect yourself is to get vaccinated and protect yourself by using that mask and distancing and those public health measures that we discussed while you're waiting for that vaccine to take effect, which takes for the RNA vaccines 5 and 6 weeks for the Pfizer and Moderna vaccine, respectively. And
you know, when you said it might be still here, some people are saying scientifically that we might have it forever, like a flu or like a cold or like anything else, but it won't have the same outcomes as you're vaccinated, just like the other diseases I just mentioned. So it's possible that we might, you know, have it for our whole lives, right?
Yeah, I fully agree with that. I think that's what this virus is going to do. But once we get the world, you know, with some level of immunity, and then, you know, it'll be, you know, a less devastating, you know, consequence.
I really hope you're right. So the answer is we have to be patient and we have to just get vaccinated, of course, right? And hope.
Yeah, I mean, the answer to get out of this pandemic is to get as many people vaccinated as soon as possible. All these deaths that are occurring right now, and we're averaging greater than 300 a day in this country, which is not a small number, they're all preventable. We have enough vaccine and we've had enough time to get everyone vaccinated. We just haven't gotten it done. And so we need to get people vaccinated. The public health measures are sort of a little Dutch boy measure to try to get us to vaccination. You know, they're imperfect. You can't wear a mask when you're eating and drinking, right? And so you're still going to be putting yourselves in risky situations. The solution is to get vaccinated.
And if people have questions about any of these issues, doctors, where should they turn?
I think there's a variety of sources where people could look up some very important and valuable information. Erie County, New York State, the CDC all have great websites with frequently asked questions about COVID in general or about our vaccines. And some people are a little uncomfortable, believe it or not, going to government-based sites. A sort of neutral site that I like a lot is the New England Journal of Medicine, which covers the same material. It's really our best medical journal, and that's a non-governmental alternative to get great and accurate information.
Or they could just watch our program now, and they could listen to you. And then all would be well, right? Thank you so much, Dr. Thomas Russo, Chief of the Division of Infectious Diseases in the Department of Medicine at the Jacobs School of Medicine. We're so honored that you could spend some time with us to offer the big picture on the COVID crisis. Thank you so much.
My pleasure.
When we come back, we will head out to Hamburg to see how organizers there are planning for the fair. Please stay with us.